Welcome to Dental Growth Partners. This channel is dedicated to helping dentists grow their practices, attract more patients and deliver exceptional care. We will be covering lots and lots of different views and topics from a marketeer's point of view and from a dentist's point of view. So without further ado, let's speak to Dr. Murray, who is a dentist. I'm a marketeer, and we'll find out a little bit about each other before we go into this month's podcast.
Great. So yeah, I'm a dentist, own my own practice, set up my practice Forever Dental and Skin 5 years ago, and we've been working together to grow the practice. We've been, I'd say, reasonably successful, sort of going from 0 patients to probably last of looking sort of over 1,500 private dental practice patients. We've sort of learned along the way some new strategies in how to attract patients, how to present ourselves. So it's been, we can chat about the approaches that we use, what we've learned, and get into the detail of how that works.
Yeah, and I'm a marketeer. I've been a marketeer for probably 10 to 12 years. Started off, social media, lifestyle, sort of growing my own Facebook and Instagram pages, and then sort of realised I had a bit of a talent for it, and then started working with lots of different types of companies, built companies to over 6 figures, growing all their social media, producing content, and then we've gone from that to running lots of ads, millions of pounds worth of ads, so we know how ads work as well. And then specifically the last 4 or 5 years dealing with dentists, hence where we've sort of met and teamed up together, and we sort of had this idea of like, I'm a marketeer and Murray's a dentist, to get both sort of influences moving forward to try and build a practice like Forever Dental and Skin, which is your practice, in all the different ways, using AI, using targeting, using Facebook ads, using Google ads. There's so much out there that you can do to grow your practice, and being a dentist and a marketeer, we have different views on it, different, what stops you from doing things. And so this sort of channel, these sort of videos, these sort of podcasts are going to be what we do, giving you lots of takeaways where you can, if you're a dentist or a marketeer, how it can help you in growing your practice or growing your marketing company or all these little bits and pieces.
I think dental practice these days is a lot more complicated than it used to be, in terms of what the patients expect, how you have to present yourself in order to be attractive, as well as be at the sort of forefront of delivering exceptional dentistry and looking after the patients. But then you've got to have the whole package as the practice to kind of present yourself online. How do you sort of attract in new people? How do you keep the practice growing? So you can sort of, able to reinvest in all the latest technology, et cetera, So you have to have, your clinical skills, plus you need to improve your essentially practice skills to be able to run it as a successful business at a profit. So you can keep growing and you can keep investing and you can keep up with the latest things in dentistry. That's probably one of the biggest things that you don't get taught as a younger dentist. You sort of go through your clinical training and you get proficient at that, and you become a sort of hyper expert in that aspect. And then as you get to a certain stage, you want to own your own practice, and there's this big gap between you think you kind of know what you're doing, and then actually when you get into the detail, find that it's very complicated. I think that's probably been our kind of we've been on a sort of a journey essentially. When you first joined, we kind of thought, it'd be good to do social media sort of content production, so we did that, and that's good, but gradually found that actually there's a whole sort of infrastructure that, if it's all working together, works a lot better. And if you're just doing one piece of the puzzle, I tend to find that it has an effect, but it's not as strong as it could be. What have you found? Because you've got a number of dental clients. Like what have you found working?
What I found is you find all dentists are very highly intelligent. So, and they have this way where they've been taught with their dentistry. They have this way of working through things, and it's like, where they're intelligent, right, I can do this, I can do that, and it's just like there's not enough time in the days. So the good thing is that most dentists that I work with, they know what I'm talking about. They sort of get it. They understand they need to do content for their social media, or they need to do email marketing, or they need to run Facebook ads. They have a rough idea, which is great because it's sort of like we found it. It sort of gives you that platform to actually
Yeah.
do some good work and actually grow your practice because the dentists actually understand what they need to do. There's just not enough days, not enough hours in the day
Yeah.
to actually start doing all these things. But it really is a lot of work, isn't it?
Yeah.
You know, even just setting up ads, or even getting the right person on reception, or you know, letting people know about the technology that you've got.
Yeah.
It's just an ongoing thing. What would you say is what stops you progressing as a dentist, of growing the practice, getting more patients? What is the main thing that stops you from accomplishing that? Do you think?
The biggest challenge for us in the practice is dealing with sort of the volume of new patients. So if we want to see people who sort of really want what we offer, and we're sort of in a niche essentially in that. So we can attract in inquiries, but really then it's the case of sort of managing those and sort of making
Yeah.
sure they're the right type of patient for what we offer. Um, and this is like the biggest challenge really, is that you're spending, or I spend most of my time in the surgery very focused on the patient that I'm looking after.
Yeah.
And it's hard to then sort of train team members into essentially sort of sales activities. Again, they were sort of originally trained into being sort of clinical assistants, and actually these are sort of like more business skills. And one, as a dentist, you kind of understand it, but you haven't been professionally trained to train other people in business type skills. You're very sort of clinical.
Yeah.
You can teach them how to sort of run the dental practice, but then these activities are sort of dealing with inquiries that are maybe sort of just need more information, etc., and they might need a sort of a triaging step, etc. Then
Yeah.
these are actually sort of sales skills that, as clinically trained people, we don't sort of get taught, and then you're not trained to teach other people either. But the biggest sort of, as a practice owner, that what you want is to be sort of growing sustainably,
Yeah.
so that you can. Yeah, here at Forever Dental and Skin, we sort of were quite ambitious. We sort of built a big practice with the intention of filling it up. So we have sort of extra capacity that we're gradually growing into, but it's just kind of doing that in a sort of in a stable, sustainable rate. We don't want to grow too fast where we can't sort of overwhelm the team, but at the same time we need to sort of gradually fill it up to its capacity, so that essentially it's efficient and that it kind of makes use of the property and the opportunity that we have here. So these are sort of the challenges day to day, is sort of sort of coaching other people into a system. And this is the difference maybe between a lot of marketing agencies. They're just interested in the lead generation side. So this is just like ads, then they get like people's contact information, and then they sort of say, right, over to you, and we'll provide you with the volume. But there's a big sort of difference in like the quality of those leads. So you can have high volume, low quality, and then that means it's sort of practice has to sort of be sitting out, and then that's a lot of work. And then also your team gets sort of not necessarily the best people to be doing that, because they're not sort of sales coached, so they get sort of demotivated if they're calling lots of people, they don't answer the phone, all this sort of thing.
Yeah.
So this is kind of all these volume versus quality is kind of a problem or a sort of challenge in marketing.
It's something I've heard a lot over the years, and it's actually changed quite a bit. When I first got into marketing, it was very much like, right, we would just get the leads. There you go, you sort them out, and it'll be by the end of the month, it'll be like, well, you've got like 100 leads, but we've only actually converted 2. What's happened? I've given you those leads, and you're like, well, they're not very good, them leads. And so that was what used to happen. More now, what we've done with Forever Dental Skin is that you're very, very lucky that you've got a really good receptionist who answers the phone, who speaks to potential customers and that, which a lot of practices I find, there's a high turnover of that front of desk sort of person, which is the downfall of a lot of practices growing, I think. So what we've done is we've run our ads, but we've put in a couple of places where we triage, we pre-qualify those particular leads through using AI and things like that. but also through booking automatically, like Zoom calls
Yeah.
with the TCO or with yourself to triage them people down. So it might not be what they need, might it? It might be,
Yeah.
oh yeah,
Yeah, some people
we're getting
it's not.
Invisalign done. It might not be totally appropriate for them, or the full jaw implant or whatever. So we put those sort of practices in place, and you get a much better quality of lead that and the TCO front of house Amanda's been trained up. She knows exactly what she's doing as well,
Yeah.
and that's what I mean. It's changed such a lot from when I first started marketing to what it is now. But I think a lot of practices that I've come across, it's bridging that gap, isn't it? Getting into that, and everyone wants to be really really busy, but what you need to be, like we worked out, was that you need to be busy with the higher quality clients like Invisalign, your jaw implants, your orthodontics, the high paying, high quality products.
Yeah, as
You want to be busy with all those as well as doing a bit of general dentistry, but you want to be busy with the stuff where you're making a lot of profit to grow your wealth and your practice.
yeah, in terms of running the practice, that's essentially, and as a dentist, you want to be doing the things that you train to do. So you want to be doing your sort of high skill treatments, but obviously it's sort of matching that with finding the people who need it. So it's a case of sort of matching how you present online, how you present sort of the practice locally, so that the people who kind of need the high sort of value treatment, they actually see you as the best person that they can come and see. And it's sort of getting that balance of attracting in the right people who kind of need it, and then being able to run it as a system. Would you say that's the sort of biggest difference when you start working with practices? Like the overall system has to be a lot more complex than you realise?
Yes, it's. I think dentists sort of get it, but they don't realise how much work's involved with it. There's such a lot of work of getting the projects and everything into a way of how it works. And if one bit falls out, like you can be having all these really good leads coming through,
Yeah.
but if your front of desk or TCO isn't trained or is good at booking them in for a Zoom call with yourself, hence why we use AI as well. We use a combination of everything. But I think there's two ways we've worked out, and looking at what everyone else does and working with lots of dentists to grow. And you combine these two as well. You can either be what we would call like an influencer dentist. Like there's lots of dentists out there who just constantly put out lots of content about their dentistry, about whatever they're good at, whatever they specialise at on their Instagram, their YouTube, their Facebook, TikTok, all that type of stuff.
Yeah.
That's how they get a lot of their business, because people see that they're good at what they do and testimonials, all that type of thing.
Yeah.
And then you get where you run lots of ads, to push people like we do as well to your, whatever product you're selling, the Invisalign, full job, whatever it is, and then you grow that way. But what we've done is that we've got the two together.
Yeah.
So you have like a video session every month, plus we run the ads, so it sort of complements itself.
Yeah.
You get a lot better quality leads as well. I don't know how you feel like how that's changed from 5 years ago when we first started out doing your marketing.
Yeah, I think the type of practice we are sort of general dentist with cosmetic dentistry. My sort of profile is I do sort of Invisalign, fixed braces, implants. So I want sort of a mixture of everything coming in. Whereas there are people in particularly in like bigger cities who can just focus on one treatment, and that's all they spend their time doing. But for your sort of general practice or like a community that needs like a sort of high quality dental practice that can offer the full range of what modern dentistry is, I think the strategy that we've developed is actually the right one, where you kind of get in, you sort of demonstrate what you can do in the sort of treatments and before and afters and testimonials, etc. with that. But then you also the whole there's sort of like a synergistic kind of picture where you're sort of presenting the practice as a sort of a whole to the community, and they can sort of then bring themselves, bring their relatives, bring their family. I found it
very much with Forever Dental Skin. It's since I've worked with you, it's grown as a community. We was just talking about one of the receptionists is going on a couple of courses, and
Yeah.
everyone in the community is like speaking to her, like, "Oh, what are you doing this? What are you doing that?" They sort of
Yeah.
look what's happening, because it's part of the community, your dentistry, and that,
Yeah.
and doing the adverts and doing the video stuff and putting it out there in the groups, Facebook groups, and things like that. It's all everyone gets to hear about it. It's like. With social media now, I don't think you can put enough content out there. Even if you put 10 bits of content out there, what you're doing is you're vying for space, for
Yeah.
people's attention, aren't you? So having it with the community and everything else as part of the whole thing, I think it's really the way every practice should be doing it.
And as like some marketing expert, what is the sort of everything content has gradually sort of changed. So it was like all about sort of posts and yeah, sort of before and afters probably a while ago. But now would you feel it's like all about video now, or what's the sort of trend in that? What should people be spending their effort?
It's I would say if depends on your what as a practice that you specialise in. So just say you want to grow your Invisalign, you want to do more Invisalign patients, just as an example. I would do the before and afters on your social media.
Yeah.
I would probably invest, to be fair, £50 a day on per advert for Invisalign. I don't less than that. I don't think you're reaching the right
Number of people.
the right amount of people in your area. You've
Yeah.
got to be spending a couple of £1,000 budget Facebook ads minimum. I think every month on your adverts. Get someone who does
Yeah.
real good adverts, lots of different adverts. Refresh those adverts. Good copy, good headlines, good hooks. Good. There's a lot of work involved. Sit down with the practice and go through how they want to project themselves as a brand as well. So everything's got to be branded. You've got to have all the right colours. You've got to have, it's a whole thing, isn't it? It's not just, we'll just bang a few adverts out there and hopefully a few people will walk through the door. There's a lot more to it, to it, and it's forever changing with technology and the way, what with AI coming in as well, and the way technology changes, not only for the dentist, but for the marketeer. It's that's what I like. That's what interests me. It's always changing. There's always something going on. There's always opportunities to do things with the marketing and the dentist as well.
And what would your advice be on sort of branding for dentists? Because it's got to be that sort of luxury. Well, if you're sort of marketing a dental sort of treatment, it's kind of at a luxury price point. So what are the sort of like the key sort of like the key bits that have to be ticked as such for like someone marketing themselves as a private dentist?
I would say professionalism, that type of thing. You can use that. I mean, it's a very clinical environment. Lots of whites, isn't there? Lots of that type of thing. So keep it pretty simple. You don't want loads of colours everywhere. You want to keep it, black and white work very well. I've seen a lot of successful dentists. They either go one of those ways, either like a all black practice with gold, that type of thing. Luxury feel to it, or it's all clinical, all white with a luxury feel to it, professional feel. For sort of branding, that's what I'll do. Have a nice simple logo, not loads of words and everything going on, and that just make it nice and professional, really.
Yeah. And the sort of luxury feel of it, like how do you feel that they kind of get that across? Like sort of, it's a bit like the lifestyle, or trying to project that kind of lifestyle.
Yes, I mean, I would definitely, if you're looking at content on Instagram, Facebook, and that, definitely the lifestyle of like before and afters. Try and do some testimonials with they really work really well with your clients who come in for Invisalign. Holding the bag works really well, or a video, a short 15, 20-second, 30-second video of just the lady or gentleman talking about how it's improved which it is, they're not lying, it's improved their look, their feel, they're confident and everything like that. Those type of things is you're showing someone what how to get around their problems. So if they've got, like myself, I had Invisalign and that, I need to straighten my teeth out and that, and with the technology, show that in a video about using the iTuro scan and this is what it can look like, this is what it's going to look like. Oh, bloody hell, will it? Right, yeah, where do I sign?
Yeah.
That type of thing. So.
And it's often something that people have had a dental problem for some time, and then they're sort of maybe like looking at it, and they kind of it's kind of helping people find the right person for them. So it's like if you're just putting out sort of your website, not much about yourself, you're not really helping patients get to know you, and that this is kind of the technology shift, I guess, from like say 10 years ago. You would have had a nice website, nice photo of yourself,
Yeah.
bit of a bio about
You still need to have that, I think.
your training,
But
etc.
what really works, what resonates with potential customers, clients, people who use, just say again, Invisalign is the dentist.
Yeah,
You know that you're approachable, that you're going to deal with their problems, with the pain that people have. You know, you're going to walk them through, and that's why having like a Zoom call,
yeah,
you're triaging that person down. You're giving them the confidence of what's
and then
what's
get to
going
know
to be
you a little
happening
bit.
and that.
Yeah,
You know, that type of thing, or even landing pages with the before and afters, that type of thing. You know, there's loads you can do to triage that person all the way down, make them feel good about what they're going to do. That's sort of like they're happy to go ahead with the treatment, I think, and it is evolved all around the dentist who's actually going to be doing it, I think.
in terms of, so we've kind of your background on sort of social media, you've got a lot. You sort of were in the sort of hobby space, sort of building
Yes,
yourself
yeah,
up
sort
as
of
a,
influencer on certain
yeah.
things and that,
So tell us a little
growing
bit more about
accounts.
how that kind of how you did it back in. Obviously, you still got those things going on, but how did you go from where you were to kind of making yourself like an influencer or like prominent in a field with social media?
It's all about, there's two things. It's putting out lots of content.
What
And
is that? Because it just chat people through that a bit. Like what
well,
is currently like what sort of schedule would you kind of say? It's
because
like,
I've sort of grown my next one or two posts a day on Instagram,
yeah,
one or two posts a day on Facebook.
yeah,
To really grow really quickly, I would say
which
four
is
posts,
quite a lot.
which is a lot. So 4 posts a day, if you're
So
a
as
practice or any other type of thing, which is like blows your mind.
a dentist, I'm already thinking I haven't got time for that.
Exactly. So, but if it depends on where you are and what you want to do.
Yeah.
If you want to grow really fast, 4 posts a day,
Okay.
videos, carousels, stories, all those sort of things about the practice, about the dentist, about what you're doing, all those type of things. Engagement. You've got to be speaking. Something I see all the time is that you'll get a dentist put something up, like a really nice video about before and after or something like that, and you'll start getting comments, oh, how much is that? Or where are you based? Or where are you at? And no one answers them.
Yeah.
There's no engagement. There's no the start of something between you and that potential client. You have to answer them. I have to answer them questions or them DMs.
Yeah.
You know, them direct messages, that type of thing. Start getting the conversation going. That's what people want to trust. You're trying to build the trust. You're trying to give them value. You're trying to drag them into what they want to do in the best possible way, and create that trust and value for them.
Yeah.
That's with anything. It's not just dentistry. That's with any sort of business out there.
And in terms of sort of like the complete like architecture that kind of works, so obviously we started just like with one channel, so sort of Facebook, and we would do it Facebook obviously, and then Instagram is part of that. So you kind of can post, and you get the benefit of being on sort of two platforms, which like Facebook is, would you say, sort of slightly older?
Yeah, it's definitely a demographic difference. Facebook, I would say, is your older demographic. You're sort of like 40 plus, retirees as well, which is where you want to just say you want to be doing concentrate on jaw implants, half or full jaw implants.
Yeah,
you're going to be like the
bigger
50, 60, 70-year-olds, aren't you? You're not going to want the 25-year-olds.
Yeah.
Very rare that would be something that you'd be doing. So you have to put your ad spend and ad expertise into different platforms. Whereas your Invisalign, yes, it does work on Facebook, don't get me wrong, but more like your Instagram pictures and your young ladies and your young men who want a really nice, smile and that.
Yeah.
So I would probably put more effort and more money into the Instagram side of things for that, more stories, more before and afters, that type of thing, to grow your influence on there and obviously get more business that way.
And in terms of like the reach of the practice, obviously we're like a local business, so there's sort of that's, you can make yourself like you're an influencer across the country, probably like across internationally even. But we're obviously sort of like a local business. So what would you say the difference is for like a local business marketing themselves versus like obviously some people are on the influence and they're trying to make themselves really famous?
Yeah, it's for because there's lots of different dentists everywhere, isn't there? So I find it's normally within about a 7 mile radius. Is 5 to 7 miles is where you want to be targeting your audience, whatever that may be, with your ads. You know, plus 7 kilometers is plus 5 kilometers of your from where you're
Base, yeah.
from where you're based. And even if you've got like some dentists have like 3 or 4 different dentists, don't they? In,
Yeah.
like part
Yeah.
of their thing. I'd run ads for each individual one, not just one ad for the whole 4. One
in terms
run
of
each
multiple
individual ad.
location
Exactly.
practices.
You need to make that area yours. That 7 mile yours. There's two ways of doing it, which I always say is that you can run just your normal brand awareness ads, so which are very cheap to run on Facebook, where all it does is just puts it out to everybody. Cheap. This is what the practice does, short and sweet, and it's just constantly running. And that person might see that twice in a month, or they might see it once, or so it's constantly in mind. It's like when you watch the telly, you watch something, and you don't always buy the first time, do you?
Yeah.
You sort of like something happen in your life, and you'll be like,
chip a tooth.
oh yeah, Sainsbury's sell that.
Someone's got a toothache in your office.
Or Tesco's doing that at the moment. I've seen 5 adverts about whatever it is. So you do that, but you back that up with your dedicated service ads, like for Invisalign or whatever, which is running to targeted audience, age and sex and what their interests are and that type of thing. So you've got two sort of ways of advertising your little area.
Yeah.
To drag them people in, whatever part of dentistry it is. And I think we've found, haven't we, that you can be advertising for Invisalign or whatever it is, but you get people signing up, becoming patients.
Yeah, we kind of noticed
because of that.
Yeah, because at one point when we were growing, it's just like obviously I said we we took on a bigger premises, so sort of cash flow at year 3 got sort of tight because you started to expand. We'd set up the second chair, take on more staff, all these sort of things. So yeah, it's one of the things that you think you can maybe like drop the spending on. You sort of reduce the amount you're spending on paid ads, but then we gradually noticed that although those treatments were still getting people coming in for them, but actually the overall sort of diaries started to sort of lighten, and then we sort of luckily we'd sort of grown a bit just through time, and then we're able to sort of turn them back on, and then just notice the diaries pick up with everything, even though we're sort of really only emphasising a few of the treatments that we offer, or a few of the sort of specialty treatments that we offer. So this is like maybe this. Would you say this is quite difficult for people to kind of understand, because they sort of as a client of yours, they sort of
as a client say, you see that as wasted money.
What's the direct influence? But it's kind of
it's no advertising is bad advertising. I don't think. When you're putting it out, whether it's in a Facebook group, whether it's an advert for specific treatment, whether it's just an advert for the practice. As I say, people are going to see this, people are going to remember this, and it may not be for that particular treatment. They might come in for something else. The good thing is, once you start filling up your diary with high quality leads, then you can start adding either another chair. Or you can add something like you do with the cosmetic side of things, and get specialists to do that. But there's a lot of call for that with the ladies and gentlemen as well, isn't there? So you can actually you've got the finances to be able to go, look, we can add this to grow your business, can't you?
Yeah, and also it's just nice for the patients to have other things that they already trust you. So there's certain like complementary treatments, like so in that case, sort of anti-wrinkle injections, dermal fillers, polynucleotides, these sort of things. The patients some of them are interested in these sort of things, but it's having someone who can offer that to them within a premises and within a medical setting where they're already registered, they already trust, rather than have to go sort of looking for that elsewhere. So I think that's, as running a practice, like a sort of, I guess it's a marketing concept, but you kind of have as a dentist, you have a list, which in a marketing thing is a thing. And you're essentially looking after them, and they're coming to see you regularly, and you sort of topping up with new patients, and at the same time probably losing a few patients who sort of move away, or they sort of just lose sort of connection with the practice. So you sort of got to be topping up to replace the ones that are leaving. Plus also you've got other things to offer the people that are already with you. You obviously offering them the routine stuff, then they're going to have develop problems. Obviously you're sort of helping them with those. But if there are things that as a practice, as a dentist, you're doing one thing, but it's kind of in terms of developing your practice, sometimes you might be able to add in other things that they kind of benefit from, or So that's quite a sort of useful way to sort of understand how to grow your practice as well. Is you having different people who can offer different things, or different dentists within the practice.
It's quite interesting from a marketer's point of view as well, watching how the dentists do things and their struggles, and trying to create something to help that, or grow this part of it and all that type of thing. And that's something we're gonna cover in all these sort of podcast videos, is the different pillars, the different things like SEO and AI and emailing and Facebook ads and Google ads and TikTok and Instagram and videography and all these things we're going to cover as we go along. So it's going to be, if you haven't subscribed or you haven't given us a like, it helps us. Then you won't miss any of these videos coming up.
Yeah. And in terms of obviously working with dentists, what are your kind of what are your takeaways? What are your frustrations?
For takeaways, most dentists actually understand marketing. They just haven't got the time. Most of them, all they want to see is the end sort of product. Most of them want to think, well, I can do this step, I can do that step, I can do this, and then they realise they probably can, but they'd have to stop doing their dentistry. They which I like, because they actually understand. If you say, well, we have to do a retargeting with your email, we have to, look at all the emails you've got and send them updated information about the services and that. Oh, yeah, I get that. Okay, yeah, I understand that. Yeah. Or about the adverts. These are the adverts we're going to do for Invisalign or half full joint implants or composite bonding. So we have with yourself, we have a day where we go through the adverts and the copy, and look, this is what we're going to say, this is how we're going to attract the people in, that type of thing. So it's interesting to get the dentist input, rather than to say, here it all is, like it used to be. There it is, there's your leads, sort it out. Now it's like you have to put systems in place to pre-qualify those leads, triage those leads, to be able to talk to them with AI, to be able to automatically book them appointments.
Yeah, this is.
There's a lot going on, but it's interesting because the dentist actually gets it, understands it. But when you actually get something, you go, look, we can automatically book into your calendar that the TCO and yourself and the other associate dentist can see coming up, or for a Zoom call. We can do this automatically from the advert or from the landing page. It's like, well, what? So I've sort of triaged that little bit out. They're a hot potential client now as well. Not a cold client. They're hot because they've gone through the advert, they've given their details, or they've gone through the landing page, they've filled out a form. So now all the automation kicks in. Also, never forget about the human side of it as well, where you need to get a Zoom call with them and talk to them, not just book them in and that's it. Because your conversion rate will drop by about half unless you have that human element in there as well.
But you say that dentistry or dentists generally they're good at that bit.
They're good at seeing the vision of what should happen.
Yeah.
And then when you start putting in all these automation things like that, like, oh, brilliant, look great. But they sort of they understand it.
But you don't enjoy it when I get into the back of Facebook and start.
No, the only problem is where a dentist is quite switched on and knows what it is. It's like you'll go into like the back end of Facebook business. And you're like, what's that doing now? And it's like, I thought I'd just change the heading on there, sort of thing like that. Or how about this picture? And it's like, no, leave it alone. Yeah. I know what works. We can work it out. But that's quite funny sometimes. Because 99% of the time it actually doesn't work. It actually messes it up, doesn't it?
Well, my experience is that I can sort of learn how all this stuff works, and it is quite interesting, and then get into it, and I kind of like it because I know dentistry is. You're quite into technology, you're quite into systems, you're quite into sort of how people think, because that's a big part of being a good dentist. Is sort of so marketing is a little bit interesting because you sort of can work out why is that interesting for them, and they're going to click on it, and you sort of see all these systems. But when actually behind the scenes, all these social media platforms are very complicated bits of software.
The reason why they're complicated a lot of times is because they're forever changing.
Yeah.
So I spend half of my time genning up and learning about the new part of the software or the stuff they've taken away.
So I've kind of got knowledgeable, or like sort of even got to the point where I can sort of do it for a couple of weeks, and then I get like super busy at the practice.
Yeah.
Kind of got other things, to manage, etc. And then I'll sort of maybe be tempted 3 months later to sort of like have another go at sort of adjusting something or putting another ad out, and then it's all changed, or
Well,
it's kind of
the thing is,
doesn't work first time, and you waste a lot of time.
that's the thing. The
kind
thing
of
is,
relearning stuff.
it's like just with Facebook ads, for instance. It's like you're put an ad out there, and you go processing. Oh, it's all done. It's all good, but it's not, because it has to go through all these things at Facebook to say, is that okay? Is that not one of the things that we shouldn't be putting out there? Is the wording all right? It's a lot of time it could be there's too many words on the actual image. You're only allowed a certain amount of words. You're not allowed to target certain people. You're not allowed to do it certain times of the day. All these type of things. And you think, oh, I've done it now. Put it out there, and you'll come back 3 days time and it hasn't even been running. I've had that quite a few times. Or it's like something as silly as like, oh, the bank account or the payment card has run out. It's glitched out because it's run out. It's gone past its date. So the advert stopped. But where you're so busy dealing with patients and things like that, it has come up as an email somewhere. But sort that out, and then you forget about it. And it's like, so your adverts aren't running. That's where like a marketing team or someone who works with the marketing, it's like they're on it straight away. So we need to do this, we need to do that. We need, that's the benefit as well of that.
Yeah, and they'll fix it.
It's time, isn't it? It's just time.
Yeah. And as you get sort of busy as a dentist, you should be spending the focus of your time should be on your patients.
Yeah, exactly.
And on your team or in-house team.
Yeah.
But you need other people doing your accounts, your marketing.
I mean, the ideal scenario for a dentist, tell me if I'm wrong, is you work 4 days a week, say.
Yeah.
Maybe 4 or 5 days a week, and you'll be doing a lot more high earning patients. So you visit, like ones we mentioned, like the 4 sort of things.
Well, doing the dentistry you enjoy. I personally, some dentists really enjoy general work, and that's great. And then they just want to be doing that and sort of looking after them or looking after the patients and doing high quality general work, which I just spend a good amount of my week doing that.
Yeah.
And then I've got an interest, background in sort of hospital surgery, etc. So sort of always wanted to do implant dentistry because it's kind of a string to my bow. And then I was also interested in pediatric dentistry in hospital, so sort of trained in orthodontics and kind of enjoy the repertoire and the complexity of everything. But then this is like a sort of you've got to eventually get so busy with everything, you've got to also target what you, as the practice grows, I need to sort of gradually sort of concentrate on the skills that only I can do. So actually sort of I'm the only
it's one. It's a bit like the 80-20 thing, where you spend 20% of your time earning 80% of your of the finances, rather than spending 80% of the time on 20% of what's gonna make your bank account better.
But it depends how my sort of vision for the practice is like being the sort of high quality dental practice locally. So we sort of want to offer that high quality routine care as well as all the sort of full repertoire of dentistry. So actually this kind of being able to look after everyone entirely, the patients really like that, rather than
because one leads into the other as well eventually over the lifespan, doesn't it?
Yeah, and this kind of feeds into that sort of I guess it's a business thing of like having a list, but essentially you might think, you're spending 80% of your time doing the general stuff. Yeah. But when they need something like complex, then
they come to you, don't they?
They like you. They don't have to go shopping for it, so it just all happens quite easily. Whereas if you're just a single treatment specialty, you then actually fill your diary with just that. You spend a lot of time sifting through sort of referrals or however you're sort of getting those patients coming to you, but you're not doing, or you're spending maybe 30-40% of your time doing procedures, but you're spending a lot of time consulting, writing letters, doing all this. So I sort of prefer the way I kind of have it. Obviously, sort of I just felt that suited me better. I kind of enjoy my general work, but it kind of with the sort of complex treatments that I do blended in. But it does mean that as I've got busy with that sort of full time.
It helps one thing helps the other, doesn't it?
Yeah, it means it takes time to keep up to date with that, and I don't have time to keep up to date with all the other
that is so forever changing.
Yeah.
How do you think in the last 5 years has marketing and dentistry changed since we've been working together? How do you think it's changed, basically?
I think there's a lot. Essentially, practices are doing a lot more. So maybe 5 years ago, you could just sort of have your website, have maybe a Facebook page, you put up some updates about the practice, and maybe feel kind of sort of general dental practice like us, that was like enough. Whereas now the whole sort of standard is kind of, you sort of have to go with the trends. So there's sort of, you have to be sort of presenting more of what you're offering essentially. So we've kind of noticed that we're sort of having to do more to kind of keep up with what people expect in terms of content. So could just post like before and afters from the clinic, or sort of ask patients for like
People just want more information about what you do, don't they?
And also technology now, it's obviously gone much more towards video, whereas 5 years ago video was like maybe slow and sort of buffering and all that sort of stuff. Whereas now people just
that's how people mostly consume their content now, is through video.
Interested in video, interested in people talking, like sort of like subtitle sort of technology that kind of made that sort of you can listen to a video or watch a video, but it's on silent and all that. And so there's
but actually there's a bit of data out there that most people actually watch that video on silent. So things like captions can improve everything by about 10-15%. So if you think of people on the train, or they're in a waiting room or something, everyone's on their phone all the time, aren't they? So they're not going to be able to just in full blast. It would be chaos, madness, wouldn't they? So they have it on silent, and they have the captions, things like that. So and they can watch that message or that video or that YouTube video just like that. So that's really come a long way, hasn't it?
And I think we're just at the sort of verge of like a big like shift in everything.
Yes.
It's kind of, obviously everyone's talking about like AI, and it's like part of the reason why we're sort of interested in sort of helping dentists with that, with the sort of transition to sort of AI within their marketing. So what are you seeing in the big?
Well, AI is a really big thing. AI is absolutely everywhere. It has been for a while, but it's really come to the forefront now. You can use AI to generate videos. You can use AI to generate images for your company. You can use AI agents to speak automatically for your WhatsApp, which we use. You can use AI voice agents now as well to book appointments, and there's so much there. But what I will say is that won't change, even though AI is coming to the forefront to help you with all these, these bookings and images and videos and automation, basically. It still depends on the input. So the AI could be the best AI in the world, the best bit of software, the best image generator, the best video generator, whatever it is, best appointment booker. But unless the input that you put in is absolutely on the level, that AI is going to fall short of what it can do for you. It's going to be a hindrance rather than something which is going to help your practice. I mean, we use AI a lot now for lots of different processes from getting that first lead to actually starting the procedure, wherever it is. We've got certain different bits in there of AI that really bring it along, really help the potential patient as well to make up their mind, give them information, book them in, that type of thing. Also with the images that you have to show them about the before and after for their teeth and things like that. It's a lot of AI. You just have to make sure the input is the best it can be. Otherwise, your AI is going to. There's no point in having it. It's a hindrance.
And we've sort of noticed it's like rapidly like changing. So again, when I sort of dabble in it, sort of understand it briefly, but actually getting into the back end and sort of adjusting everything, it's actually just another layer which kind of you need now to stay sort of with the stay with what's necessary, or
it's a real
keep
big
up with
it's a real big factor of making your practice grow, and also making it more efficient, making it more viable. It really is a big part of not just dentistry but everything now. If you can master that, or like we do, we use it and we get the inputs right because we've tested it, make sure it's all right. It really helps for their dental skin and the other clients that we deal with.
From a sort of like dental practice point of view, I think it's a great tool for like communication. So people sort of they need to ask a lot of questions. before they can sort of
Yes.
get comfortable and sort of do their research. And actually, that's probably in terms of a tool, it's an amazing
Yes.
communicator. So like ChatGPT and all these things, you can ask it a question, give you an amazing answer.
Yeah.
And actually, from a sort of in terms of getting the best out of your sort of healthcare, it's kind of gives you a fantastic tool to kind of research. So you kind of sort of find out about, it can answer the questions about, well, we give it all the information about the practice, and then it can tell you when we're open, what treatments we offer, which dentists we have here, which it gives them such a lot of information about the place.
Yeah, even things like a chat box on your website.
Yeah.
Even like part of the triaging down where people are like that they've seen the advert that we produce for, again, I use Invisalign as an example. They see the advert, they put in their details, and it's like, oh right, okay, so do you need finance? Why do you want to have your teeth done? When do you want to start? All these different things that are on that person's mind that's going to help them further down the funnel to actually using that service or getting that particular product to do with their teeth, Invisalign, whatever it is. It helps them as much as it helps you as a practice.
Yeah, I think from our like in-house, sort of obviously they're coming through like sort of these channels, but then it means you've got a lot more. You get to know them very quickly because you already got a lot of like information that they've kind of relevant information rather than have to start sort of the conversation much further back. You kind of know where they're up to with like the problem that they're trying to fix, or also like in terms of how meeting their expectation. If they really want to go ahead quickly, you can do that as well. Or if there's just want more information, or it's kind of first impressions, or I'm considering this, but I want to do it for a wedding next year. You kind of already know. Well, tell them the relevant thing, like you want to start maybe in the winter rather than start now, or whatever. It just helps like tailor everything to the individual, which is probably for me, I think, is the exciting bit for helping people with it. Is like everything's going to be tailored much more to the individual, because a lot more you can communicate with it a lot more.
But I mean, that's like one of, like you said, what I found's changed as well is that a lot of dentists, they know about all these AI things, and they start using them, and it's like the phone calls I get is like, I've started this chatbot, whether, and I'm not seeing anything because it's going the wrong way or it's not working properly, and it's all about the input.
Yeah.
Where we've done it so many times, we know what should go in there. For your particular practice, we know the questions that people want answered before they actually get down that line to actually go, okay, I want to book in for my Invisalign appointment. Whereas a lot of dentists, they're brilliant because they're very knowledgeable, and they start using, but it falls flat on its face because the input isn't right, and that's where we help them at Dental Growth Partners.
Yeah, I think it's really exciting. Like we're into our technology here at the practice, and we've got X-ray AI is like one of the things we use here, and that's like being really like fantastic. And you're sort of picking, the level of detail it gets into. It's like great from that point of view. And then we've got like we take CT scans and sort of intraoral scans. So I think that there are currently not too much like AI. I think AI helps it in terms of doing it or predicting what data it's about to pick up and stuff like this, but there's not a lot of there's kind of, I think there's more going to happen there.
Oh, definitely. I mean, do you think that you're going to have AI where I don't know if it might even be now, but where you take that X-ray and they be able to say, right, in about 7 years' time, you're going to have a problem with oral cancer or something like something like that. Do you think it'd get that good?
Maybe. I think it's essentially it picks up the slight sort of it picks up all the problems. It takes a little bit of like judgment and kind of experience to then. It's the same as what you're describing in the marketing. It's like reading the X-rays; it'll pick up absolutely everything. But when you look at it, you're like, well, that's not not really a problem. We don't need to treat that. We're just going to monitor that. But this one, you do need to treat that, etc. So at the moment, it's
a personal touch.
It's a tool. It's like an advanced tool, and it's also like reassuring because it's getting done. As in like you're not missing things which is like an anxiety,
and you can show the patient.
And it's great communication. So we put it on the screens, and then they can see like the AI picking it up and like amazed by it. So this is like in the X-ray bit, but I think the front of house essentially for us is really helpful because it's going to just help that communication thing. I'd say we're quite lucky because we've got sort of great reception team here.
Yeah, really good.
It's going to help with other practices I worked at, often, you get a change of receptionists, and then it takes them time to train up and stuff on reception, which is fine. But in terms of managing your ad spend and things,
Yes. Yeah.
obviously, if you can have a automation that answers the questions and the knowledge base about the practice, it's
Yeah.
kind
They're
of
so much further down the funnel, aren't
attractive as an know because you're not having to sort of go back a step before you can kind of say, okay, you've been here 3 months, like you should kind of know a bit more about, like, or communicate this with the patients.
they?
If they're
That's
doing
that's quite a common hold up is that front of house. After you can get the adverts in, you can get all the leads in, but it's just like it's the time waiting to actually contact that lead. It really does impact on your conversion rate.
Yeah.
I mean, the data says, and this is wholly true, is that if you don't speak to that potential customer, this is for any, not just dentistry, within 5 minutes, or make some sort of contact with them, every minute after then is another 50% off. So within 5 minutes, 50% conversion rate just falls away. Straight like that. If you speak to them within a minute, they're hot. They're at their most intense of buying that product or going through that service or there and then. But if you leave it, just say you leave it to the next day, like a lot of
busy.
Basically, if it's a Sunday night or a Saturday, you're not open. You're not going to be open for another 48 hours. They've probably booked with someone else, or they've thought, "Oh, no, I can't be bothered with that." They spoke to their family. No, you don't want that, and it's gone. Then it's a cold lead. Whereas if you've got some sort of AI automation, or even front of house rings them straight away where they've had the training, then you're going to convert a hell of a lot more potential patients for different procedures.
Yeah, and I think that's probably for like a small dental practices on the whole.
It
That's
matters,
small,
doesn't it?
Yeah, and on the whole, they're small businesses. You have the dentist, the dental nurse, a receptionist. Maybe then you have sort of multiples of that. So you might have a few receptionists, or you might have a few dentists and a few dental nurses. But sort of your head count is generally sort of between, say, 5 to 15 for the sort of each premises. And then it's just getting actually sort of being that responsive where you don't have someone sitting on the phone for the advertising stuff, like 24/7, you can't afford to. So
That's right. Yeah.
So everyone's doing a sort of mix of different roles. So the receptionist is like checking patients in and out. They're doing the forms. They're doing like insurance forms.
It's like
that. So they might get the lead and they intend to get back to it straight away. But they realistically might have it
half an hour. Some people go to lunch.
Or might in the afternoon when it gets less busy, then they sort of call them back. But as I say,
and then they're not interested.
Yeah.
Or not as interested as they was. They're not as hot a prospect.
Or
as
they
was
busy,
initially,
and they're busy. They just sort of moved on to other things. Can't
so
can't answer their phone.
Just imagine like what we do. If they get a phone call, or they get a WhatsApp, or they get an SMS, or they get something straight away, to either to get them to book in or to book in there and then for the next available slot. It's like it's golden, isn't it?
So
really, for your business.
Yeah, I think this is,
and that's what we do.
Yeah, I think this is the exciting thing for like this whole sort of area is the immediacy or the automations in these processes, because they've sort of this has been like a major stumbling block for your sort of small business or your practice, and actually these automations and the AI like marketing space is actually going to solve a lot of our sort of small business problems and really make the whole service a lot better for patients, which is kind of what it's all about really, because if they can communicate, get what they need to then move on to the next step, it's actually
so it's going to be quite interesting when we do these videos about the different pillars and the different sort of bits and pieces, AI being one of them, and lots of things over the course of the the next months and months and months. And show you what we do at Dental Growth Partners, how we work with FDS, and we work with lots of other different dentists as well, different practices, and to give you value really, and to give you some takeaways from all the things that we do. So if you haven't already subscribed, please subscribe to the channel so you don't miss any more of the videos. Give this video a like as well, because it helps us get out there and grow the channel. And we want to get some guests on as well. We want to get other marketeers, other dentists who have helped, and also just put salesmen, everything around this sort of industry that's going to help you and give you value.
Yeah, marketing your dental practice the best you can, so that you can help as many patients as you can, and have the best career you can have.
Yeah, and grow, because everyone wants to grow their practice, don't they? You know, have wealth in that practice.
Yeah,
which is, and that's what we do.
You want to be busy doing what you're trained to do and doing the stuff that you enjoy doing, and there is an element of you have to learn how to do that. It doesn't fall in your lap, unfortunately.
So, I hope you've enjoyed the video, and we'll see you for the next one.